Welcome back, everybody. Have you been thinking about doing something with those unattractive spider veins working up the legs? We know somebody that can help. Actually, two somebodies. Maria Bein and Dr. Norman Bein from St. Louis Vein Specialties are here to show you your best treatment options. Welcome back to the show, guys.
Good morning.
Always nice to have you here. I think there's still a lot of confusion out there about spider veins because we're not sure if it's a strictly cosmetic issue or if it can really impact your health, or if left unattended, it can impact your health. So settle that for us.
Spider veins typically are a cosmetic issue. They're very much on the surface. However, we always do an ultrasound examination to rule out. If there's pain involved, then it could be more of a medical issue, depending on what the ultrasound shows. But otherwise, it's purely on the surface and cosmetic.
When I hear that, then I start to think about insurance, and I'm assuming if it's purely cosmetic and on the surface, maybe insurance isn't going to want to pony up for this.
Insurance is getting more difficult every day, and definitely they do not cover spider veins.
So what do we do about them? Because they are, at the very least, an aesthetic issue that make a lot of people uncomfortable. So what are the treatment options?
There's several. We adapt our treatments to the patient, what they need. So we check below the spider veins to make sure if there are any feeder veins, because they need to be treated. We treat those. We treat the surface veins either with injection or a combination of some injection and some laser, some topical laser. We're
showing some before and after photos here, and feel free to interject, but it looks like, you know, your cases are going to vary a lot. Some people are going to have very evident, very visible, and numerous spider veins. Sometimes maybe it's just one concentrated area, but either way, you guys can help out, it sounds like.
Definitely. Some people are unfortunate and they have them pretty much diffusely over their legs.
Other people right there looks like a more significant case.
Yes, and she had them on her lower legs as well. But some people just come with a couple of small ones, but it really bothers them and they want it treated.
I hear you guys promote compression hose from time to time. Is that something that can help here, and why does it help?
We use compression as part of the treatment. We apply them immediately after the treatment, and they're in them for about a week maybe. Does it help? It won't help prevent spider veins, but it certainly can help slow down the process, especially if you're in a job where you're standing extensively or sitting for a long time or traveling. Can slow down the process.
Gotcha. And Dr. Bein, I know you guys have this vein light that you can use. Is this something you use to help you detect spider vein problems too?
If the spider veins are a cosmetic problem, you want to be very careful how you spend your money. What we do works, and what we do works because we go to the deepest part of anybody's problem. Unless you are getting an ultrasound study at the time that you're initially evaluated, which we perform complimentary. I perform ultrasound studies on everybody that we see before any treatment plans are made. If the ultrasound studies show no deeper problems, then our injection treatment and our laser treatment will solve your problem. If there is a deeper problem, then of course we'll get insurance involved and they will cover, based upon what we see, the procedure itself. But spider veins themselves are cosmetic. You do not want to be spending money on maintenance therapy when you can be treated correctly the first time, and that's what we're all about. Yes, that's
what we want.
Exactly right.
Yeah, we want to wash our hands of it. And we don't know really what we're looking at on our legs, if it's spider veins or something else. That's why you go see the experts. Dr. Bein and Maria, thank you both so much for being here.
Absolute pleasure.
If you have other questions or are interested in treatment, give Dr. Norman Bein a call. The number for St. Louis Vein Specialties is on your screen. It's 314-993-8233. Or you can call them toll-free, 866-626-VEIN, Vein. Kent?
Thank you, folks. All right, coming up on Great Day St. Louis, put the cell phone down.
It's right here.
I know it is. Put it down. Coming up, we're going to disconnect from our digital devices. A doctor is telling us why having a tech timeout may be good for your family. Has to be good for your family.
And for yourself.
Yeah.
And the STL Veg Girl is putting a vegan twist on some classic American sandwiches. So think grilled cheese without the cheese and a BLT minus the bacon. Can it be done? What will it taste like? We will find out.
It's a vegasm. Coming up. Time now for this week's Eye on St. Louis feature. Can you believe this? Today marks the 50,000th day since Forest Park was officially established. 50,000 days back to June 24th, 1876. And these pictures just show us how far the park has come over the years, the change for the better over the years. Forest Park Forever celebrating the occasion with the Recounting 50,000 Days campaign. Organizers working to gather 50,000 memories of Forest Park.
Wow.
You can share your best photo or story in several ways: Facebook, Twitter, Instagram, email, or mail. This Eye on St. Louis feature brought to you by Illinois Eye Surgeons. Their team of doctors can handle any of your eye issues. Call toll-free 855-260-EYES or go to illinoiseye.com.